Hello, and welcome to the latest episode of AI Med Talks. I'm Freddy White, the CEO of AI Med, and joined by a couple of fantastic guests this morning. We have Art Jones, Chief Medical Officer for Health Management Associates, and Andrew I, CEO of Closedloop. Today's discussion is going to be looking at free open-source AI-based tools to identify individuals vulnerable to severe complications of COVID-19. We're going to get started with you, Andrew. So why don't you tell us a little bit about yourself and where you're from and what you've been up to?
Sure. Thanks, Freddie. Yes, my name's Andrew I. I'm the CEO and co-founder of a company called Closedloop. We like to refer to Closedloop as healthcare's data science platform. And we've recently launched an open source project called the COVID-19 Vulnerability Index. That's available at cv19index.com. So that's what we're here to talk about today.
Thanks, Andrew. And Art, what about yourself? Tell us a bit about who you are, what you do, and whereabouts you're based.
So my name is Art Jones. I am the Chief Medical Officer of Medical Home Network. Medical Home Network is a Medicaid ACO in the Chicago area comprised of 10 federally qualified health centers and 3 health systems. We have 122,000 Medicaid beneficiaries that we are delegated for care management responsibilities and serve them under a shared risk arrangement for total cost of care.
Great. Well, thanks very much for the introduction, guys. So, Andrew, as you mentioned, Closedloop have developed this open source AI tool. I wonder if you wouldn't mind just telling us a little bit about the background, how you guys came up with this and kind of what you've worked on so far.
Sure. So about 3 weeks ago now, we had the idea, is there some way that we can get involved and help in this fight against COVID-19. A lot of our customers are in the population health space, care management teams and so forth. And so as we thought about, how are those teams going to be reapplied as this virus spreads, we thought there may be an opportunity for us to help prioritize resources. And so in conjunction with Art and his team at Medical Home Network, we started to explore, since there wasn't a lot of COVID-19 data available yet, how might we create a model that we could use to predict folks who are going to have severe complications related to COVID-19. And so the product of that work was released this past Monday at cv19index.com, an open source tool that's trained on historical patterns related to severe infections around respiratory diseases, and using that as a proxy to folks who will ultimately end up with severe complications related to COVID-19.
Great. And Art, I wonder if you could just tell us a little bit about how yourself and the team at Closedloop kind of collaborated on this, and have you started using this, and kind of how's it been going so far?
We have been working with Closedloop for the past 2 years as far as risk stratification for identifying high-risk members for care management. We have a separate algorithm we use for identifying people that are high risk for readmission. But as we looked at this, we wanted to identify who are our patients that were at high risk for complications once they were infected with COVID-19, and particularly wanted to use a machine learning approach. We've seen what's in the literature as far as certain populations, like those with heart disease or lung disease or diabetes are at risk, but we wanted to really be able to focus and get down to the highest risk subpopulation so we could do focus outreach. And we also, as an ACO, do a health risk screening on all of our patients. And so we have data on certain social determinants of health we also thought would be important to contribute to identify which members we could most impact with care management. And the 3 specific questions that we look at is we know which of our population are homeless. So out of our 122,000 members, we have 386 that are homeless. We also have almost 5,000 that say that they live alone. And we also have close to 10,000 that answered that if they got sick, they didn't have a family or other person that could help, they could turn to for assistance. So kind of judging on what we learned in 1995 in Chicago with the heat wave, that was a severe heat wave that summer. And it turned out there was a high death rate, particularly in people that were socially isolated. So in this time of calling for social isolation, there also is a role of having other family and friends to help you if you happen to get sick. So we wanted to use AI to identify who should we reach out to first for the purpose of saying, who do we want to educate about prevention? Who do we want to educate in terms of recognizing early their symptoms? And then helping them identify what should I do if I develop those symptoms.
Andrew, any thoughts you want to put in there?
Yeah, I think it's interesting, in working with Art and his care management team, some of the typical interventions that team would run are kind of being turned on their head in the face of COVID-19. As an example, care management teams may often do things like home site visits. Home site visits clearly are things that are riskier and are being turned down at this point. And so to Art's point, reaching out to those folks, not only who are at high risk, but specifically those who are socially isolated, those are the folks who may feel like, hey, if I don't have enough supplies, I need to walk down to the corner store myself. And the challenge is that because they are so vulnerable, if they walk down to the corner store and if they do in fact contract the disease, we know they're going to have a very hard time fighting it off. And so the first step in this, I think, is outreach and establishing a relationship with those folks and letting them know, if you don't have a friend that can deliver toilet paper, perhaps these care teams can help to mobilize resources in order to bring those things to the folks who are most vulnerable. At the end of the day, what we're trying to do is protect the vulnerable and really allow them to shelter in place. And I think that ultimately is the hard work that Art and his team are doing.
That's great.
Yeah, I would just add that the initial response when someone like this gets sick is to go to see the doctor, go to the emergency room. And actually, that's what we don't want them necessarily to do. We want to be able to contact their primary care provider or their care manager who can help them make a decision that, yes, I may have the symptoms, but the best thing for me is actually to stay at home. And what should I be looking for as far as deterioration of my condition that would prompt me to go to my primary care provider or ED. So unlike usual, we really don't want them to be their first response when I get sick is to go see the doctor.
And from the initial use of this, what's the results been like so far, Art?
So we actually today is the first day that we are rolling out as far as contacting. So we've gotten the list of patients. We actually developed a protocol for our care managers. Our care managers are all part of the care teams in the primary care homes. So these calls are coming out from the primary care homes. And there is a script for them to do and to run through as far as education and prevention. So today is the first day that we're actually implementing the protocol.
Just to add to that, Freddie, what we're seeing, a number of folks have been evaluating this in retrospective tests. And so the model was developed training on a population of over 3 million Medicare patients, historical data from CMS. Once we had that model, we now have Medical Home Network, the first that has evaluated that, looked at the results, added their own proprietary data. In the case of Medical Home Network, they have very rich data on social determinants. So we've been able to extend that model to take advantage of all the data that they have. But ultimately, Art and his team are looking at those test sets that we've done and saying, do the patients that come to the top of this list make sense? And so that retrospective analysis has happened already with Medical Home Network, and they're just now rolling it out. That same retrospective analysis is happening for over 2.6 million patients across the country right now. So we have customers actively testing in New York, Florida, Boston. And so the key here is for folks to be able to take this score, which is open source, available for them to download themselves or work with Closed Loop. We can walk them through that process. But through a retrospective analysis, their care teams can get comfortable that, yes, this is surfacing the types of people we would want at the top of the list, and then slowly roll that out and actually implement it in practice.
Well, thank you so much and I'm right in saying, Andrew, this is completely open source, so people can go on and use this tool for free. Is that right?
That's absolutely right, Freddie. So we're deploying this in 3 ways. The simplest way to use it is through a spreadsheet. And so there's a very simple version of the model where you can import data through a spreadsheet, score those patients, and what you get back is not only kind of a risk score, but also the top contributing factors. What were the risk factors that we saw for each individual patient that led us to believe that they were high risk? That's really important in these retrospective tests because you're able to get some sense as to how is that AI score working, and you can have clinical folks actually review those results and confirm them. And so that is available through an open source download that can be run against spreadsheets. It's available hosted on Amazon in their SageMaker environment. And it's also available hosted in our closed loop HIPAA compliant cloud. We'd encourage folks who are evaluating the open source or any of those 3 deployment options to reach out to us for our help in just kind of standing that tool up. But yes, this can be run in your own environment and as simple as running a script against a spreadsheet. To clarify, all 3 of those are open source. All 3 of those are completely free for use. There's absolutely no cost associated with any of these tools.
That's fantastic. Thank you, Edra. And we'll make sure that we share all of that information through the AI Med network as well. Art, thank you so much for joining this morning. It sounds like you guys have got an incredibly busy period coming up, so I don't want to take any more of your time, but I really appreciate you taking the time out to chat to us today. So thank you very much.
Thank you, Freddie, for including us, and we look forward to being able to share some of our outcomes over the next couple of weeks as we implement this protocol.
Thanks so much for the time, Freddie, and for the audience. And just as a quick reminder, it is cv19index.com for more information. We'd encourage folks to let us know if you're using the tool, contribute to the open source project. We want to get this out as far and wide as we can to help as many people as we can. Thank you, Freddie.
Super. Thanks very much, guys. Appreciate it.